All right, awesome. Well, thanks everyone for sticking around. I know there's been a lot of great presenters. Being one of the last ones, it's kind of hard to follow everything up. So hopefully I can kind of bring the energy back up and talk about a topic that I think is very important for people with cancer, people with myeloma, and that's the nutrition side of things. So I very much agree that we had a couple of great presentations on exercise, but to support that exercise, to support the treatment, we also be needing to eat well to make sure everything works in together. I was out there looking at the buffet. I did get some food too. So, as dietitians, sometimes we can kind of seem like we're the food police, telling oh, don't eat that, don't eat that. We don't really want you to feel that way. We want to help you support your nutrition, make sure you're eating all the right things to have the best outcomes in terms of dealing with this condition, which is very difficult. So nice to see there were some protein options there, and we'll talk about why it's really important. And I noticed that there was some red meat there, and I could kind of hear a couple times, maybe a couple people wincing, like, oh, maybe I'm going to stick away from this. But maybe today we'll talk a little bit about that more in depth. Okay, so before I get started, I'll just give a quick intro about myself. So, who is this, tattooed guy up here? Is he at the wrong conference right now? But I am a registered dietitian. I did my degree at the University of Alberta. I finished in 2018. So I've been working in clinical care. I was in Calgary here for the past few years, working in a variety of different conditions. So cancer, liver disease, diabetes, weight management. And I just got a text from my professor. She said, hey, would you like to get into research? So that kind of jumped me into research. I started as a master's student. Some of the research that was done earlier, mentioned earlier with the Heal Me app, I'm really involved with that in terms of the nutrition side of things. So I know sometimes technology can be a little bit of a scary thing. However, you'll see that I think a lot of the future studies that we'll be seeing will involve technology. So embracing that, I think, will allow you to be able to participate in a lot of these new research studies in order to improve your health. I'm now a PhD student, and again, my studies kind of look at tech and nutrition. A little bit of myself: I like bodybuilding, rock climbing, and video games. Okay, so for this presentation, what we're going to do is go through the 5 W's. So I want to give a good overview of protein in general, what it is, why it's important for people with cancer and myeloma, and where it comes from in the diet, understand how much you might need, and how to get more into the diet. Okay, so what is protein and why does it matter? Why didn't I come here to talk about carbs and fats and those kinds of other nutrients? Well, I think that those other nutrients get a lot of attention in the media. I think protein is kind of the underdog that doesn't get enough attention. So that's why I wanted to focus on it today. So what is protein? Protein is a powerful macronutrient. So it's like carbs, it's like fat. It provides energy to the body. Protein is basically the building block of life. We're made of protein, and without it, we wouldn't be able to be here today. So it does many things in the body. So first and foremost, muscle helps with bones, our hormones, our blood, all of our enzymes are made of protein. Our hair, skin, and nails, all very built with protein, and our immune system. So our immune system is very important for fighting disease, illness, those kinds of things. So not eating enough protein, not getting enough protein in the diet can cause malnutrition, and malnutrition is a imbalance of nutrients. So you can have too much of something, you can have too little of something, and basically what happens is that the body does not function as it should be. There can be symptoms that can arise. So there are many different things that could happen if you're not getting enough protein in the day. Issues with your hair, skin, and nails, getting sick more often. However, today I want to focus on muscle. So muscles are what got us here. So walking into this room, we used our muscles for mobility, for strength, balance, and important when it comes to cancer, treatment outcomes, and survival. So essentially, the more muscle that someone has, the better quality of life and clinical outcomes that you're going to have. Now, I'm not saying everyone here, we're going to, try to become, Arnold Schwarzenegger, but the more muscle you do have, it's going to be better for treatment outcomes and quality of life. Okay, so unfortunately, when you have chronic disease, such as myeloma or other cancers, you're going to be at higher risk for malnutrition, and there's no way around that, unfortunately. So you're in a group that you are fighting against odds, right? So it's not like you're a healthy individual if things are already difficult there, but when you add a condition on top of things, well, that adds another wrench to the bucket. So some of the reasons why someone who would be at higher risk for malnutrition with myeloma is just the condition itself. So the symptoms of myeloma can cause you nausea, vomiting, lower appetite, and reduced intake. Then you toss in the medications and then the treatment. So all of these factors here are probably going to reduce the amount of food that you're eating and likely reduce the amount of protein that you're eating as well. In addition, the disease itself and the treatment that you often get can increase your body's and energy needs. So on top of not being able to eat enough, you also need to eat more to make up for all of these things that are happening to your body and all this treatment that you're doing. In addition, this is some of the newer kind of research that is being out there. We're looking at the anabolic resistance of aging. So this is a new term, and as we all know on the cancer statistics here, so approximately 80% of myeloma diagnoses occur in individuals aged 60 years or older. So as we do get older, our ability to build muscle, to keep strong, naturally starts to decrease. So that could mean that we're not digesting the protein as well as we used to, we're not absorbing it as well as we used to, we might not be moving as much as we used to. So all of these factors also add into that idea that you're at a higher risk for losing muscle. So low muscle mass, and when you get low enough muscle mass, we can kind of define this as sarcopenia. It is a term that is associated with poorer quality of life and function in people with cancer. So this sarcopenia or low muscle mass is a defining feature of malnutrition and cancer. It's not to say that it's expected or it's going to happen, but we're not surprised when it does potentially happen in someone who is diagnosed with myeloma or other cancers. So one other thing is that this low muscle mass can be a hidden condition. So it's not limited to people who are small, people who are big. So it can happen to everyone. And this is something that happens over time, and it's really hard to notice that you've been starting to lose muscle. Sometimes it can be very obvious. You can tell that, okay, I've got weaker, but in a lot of cases, you can't really see that happen in real time. And this is why the concept of weight, so often looking at measures like body mass index, so BMI, or looking at the weight on the scale, is kind of dated when it comes to determining how healthy someone is. As you can see here on these two images, these two people will approximately look the same size, but you can see that the person here on the left has less muscle than the person on the right. So you wouldn't be able to tell that without some of the newer diagnostics that we have, new tests that we can test these muscle, the amounts of muscle in individuals. But that's why body composition is a more important thing to look at when in comparison to weight, so the weight on the scale. So one thing I really want to talk about is this wildfire of muscle loss. So hopefully this year we're not going to have too many forest fires, but I know in the past couple of years here, maybe it's been really, really smoky, hindered some of my vacation plans. But if you think about those forest fires, they're very short term. But if we think about the trees regrowing, getting all those trees back is going to take some time, right? So in cancer and cancer diagnosis, we can relate that to muscle loss, like a wildfire. So in this picture on the left here, this is someone who, let's say, for example, got recently diagnosed. And as the treatment process goes along, this muscle loss happens very quickly. And that's when sometimes people start to focus on nutrition. They've got the diagnosis and they're saying, okay, now I need to start eating healthy. However, with the muscle loss and all of the treatment that people are going through, it can be really hard to keep up with all of those, recommendations that people need to meet. And then at some point, we want to get back onto things, but, this big jump from June to December, now, we're just starting to put back on a lot of that weight that we lost from that initial period of treatment. So what we really want to do in most cases is we want to preserve. It's really what we want to do because it's much easier to preserve than rebuild. So fortunately, eating enough protein can help support maintaining and keeping that muscle on you. And in some cases, when we add all of the other components that we've talked about today, like exercise, we can actually get into a point of building. So protein and eating enough protein is one of the most researched nutrition interventions when it comes to combating muscle loss. So this figure here I really like. So thinking about tipping the scales. So on the left side here, we have a term called catabolism. On the right side, we have a term called anabolism. So catabolism basically is breaking down. Anabolism is building, right? So in the middle, we have this kind of point where muscles are always, your muscles are always, they're moving. They're not static. It's not like it's there and it's always going to be there. It's breaking down, it's building up, even right as we speak, right? We want to get to a point where the building is higher than the breakdown. So then we hit a point where we're building overall. So there's a kind of a plus and minus. However, if we can, even maintain, this is better than kind of shifting over to this left side here. So these two, muscle maintenance and muscle gain, is kind of the states that we want to ideally want to be in most of the time. So thinking about protein, I think in general, like first things that come to people's head, meat, eggs, those kinds of things. So I think that, in general, most people understand where protein come from. But there is, a number of sources that maybe potentially might be missed. And, to get enough protein in the diet, you kind of have to know what kind of foods contain it. So there are a number of different food sources. So I've kind of broken it down into different categories. We have animal and plant proteins, dairy proteins, we have protein supplements, and then there's this other category of other protein sources where, there are products nowadays on the market where they're actually, made to have higher amounts of protein. You'll see that if you read nutrition labels. So just to kind of break it down a little bit, so animal and plant sources, I'll list some of the sources here. This is not exhaustive, but we have red meats, processed meats, chicken or poultry or turkey, fish, seafood, eggs, pulses, nuts, seeds, and soy proteins. For the dairy proteins, that's your classic milk, kefir, yogurt, and cheeses. And then we also have protein supplements, which are on the market. So these are, products that have been specifically made to be very high in protein. So protein powders, bars, drinks, shakes, and replacements. And lastly, we have other sources. So a lot of whole grain products, let's say like a whole grain slice of toast or something like that, will actually have a fair amount of protein in it. And like I mentioned, there's products out there now that have been developed to have high amounts of protein. So this is a topic, again, like I mentioned outside there in the buffet. Often when you do, a quick Google search, should I eat red meat? Usually the first thing you get back is probably no. And there's a lot of misconceptions and I think confusions when it comes to animal proteins, animal products when it comes to cancer. But what the science is telling us is that the certainty of this evidence is actually very low. So in a lot of the studies which say, you got to avoid meats, those studies also included processed meats. So obviously, we know that processed meats are going to be a lot, more harmful in the diet overall if you're having it regularly because there are some ingredients in there that we know are carcinogenic. But if you combine red meats with those in those studies, well, then you're kind of painting a bad picture when it comes to those types of meats. A lot of the studies that kind of claim that you should avoid meats are observational studies. So they're not those big randomized trials where you're having groups compared against each other. They just picked a population and just looked at them shortly over time. And a lot of these studies, we aren't looking at the cooking methods. So cooking methods are very important when it comes to meat. So if we're, let's say, for example, burning meat, then you can introduce carcinogenics, those kinds of things that can kind of increase your risk for cancer. My second point here, so risk reduction does not outweigh the impact on quality of life. So we're in Alberta, right? So I mean, I'm sure even my drive from here, from Edmonton to here, I think I saw a sticker that said Alberta beef on someone's car, right? So we're proud of our farmers and that kind of thing. But if we're thinking about the Western diet in general, if someone immediately sees that, gets a diagnosis and stops eating red meat, well, if that's their main source of protein, they've all of a sudden bumped from here, this amount of protein, way down to here, right? So removing that completely from the diet is something that we don't want to do, because that, risk reduction of reducing the risk of remission, cancer coming back is not going to outweigh the getting the amount of protein from those red meats. And in addition, cooking a lot of plant-based proteins like beans or tofu, it's not something that even myself, I struggle to cook a good tofu, right? So it's not like everyone is going to be able to make a nice tofu stir fry right away. Prepping meats, animal-based proteins, in a lot of cases are a lot easier. And I'll talk a little about this, the nutrients. There is quite a bit of difference in terms of quality, in terms of the nutrients that you get from plant-based proteins versus animal proteins. And when you do a Google search on should I have red meats or these kinds of things, often the recommendations that people are talking about is the diet for cancer prevention rather than cancer treatment. We don't want to get those two confused. All of these things that I've talked about right now is for cancer prevention, right? If you reduce the amount of red meat that you're eating, it could help with reducing the prevention of cancer. But when you have myeloma, when you have cancer, that treatment diet isn't the same as, the prevention diet is not the same as the treatment diet. So two very different concepts. And that's why, as we've heard before, like Dr. Google isn't necessarily gonna help all the time, right? So in summary of this slide, we can really say is that we can't really link one specific thing to a cause of a health outcome. So we can't say that red meat specifically causes cancer. In the same way that I can't say that, if I did a study where I had someone eat like some candy and the next day they didn't have cancer, well, then I can't say that candy causes cancer, right? So we can't link a single food to the cause of an outcome. There's many different factors that come in when it comes to a cancer diagnosis. So this slide here, I just wanted to kind of highlight in terms of when someone does get, let's say, a cancer diagnosis. So up until this point, this is where we do want to have the best nutritional status in order to have the best outcomes. So at this point here is a lot of times someone will do that Google search and they'll say, okay, I got to stop eating red meat. So they remove or animal products in general. They remove all of the animal-based foods from their diet, but what happens is that their protein intake goes down, right? And then this is when that wildfire can happen. And then we try to do that reforestation, it's quite a hard grind to get that muscle back, right? So in terms of comparing animal versus plant proteins, I will not. I will definitely recommend the importance of plant proteins. However, there are some definite differences between the two. So with the animal proteins, there's a different nutrient composition in comparison to the plant proteins. So the plant proteins, they do have their benefits in terms of, and generally they are lower in calories. They're high in some of these essential fatty acids that we want to have. They're high in fiber to help with bowel routines. So they do have their nutritional benefits. But in terms of a protein source, they are not as high quality as animal-based proteins. So they might be limited in terms of some of the amino acids. So when we put them side by side in terms of protein quality, an animal-based protein is going to be more effective for muscle building and muscle stimuli in comparison to a plant-based protein, right? In terms of the literature, there hasn't been a real defined, amount to have of each. But because of the benefits of animal-based proteins, there have been suggested ratios in terms of having about 65% of your protein coming from animal-based sources because of that complete protein profile that they do provide over a plant-based protein. But again, every type of food, regardless of whatever it is, I think all foods fit. So including a variety of each is usually the best way to go. So, of course, these nutrition facts labels are almost always on every product, and I think that protein is often the underlooked, the overlooked nutrient when we're looking at these things. I think a lot of people were looking at sugars, we're looking at those kinds of things, but I think that looking at the protein at your nutrition facts label is really important to determine if it's a good source of protein. So this one here is, for example, a breakfast cereal. You know, you can definitely look in the cereal aisle, and the next time you'll see there's quite a range of the amounts of proteins when it comes to the different breakfast cereals that we have out there. So reading the nutrition facts label is very important to kind of keep that in the back of your mind when you are doing grocery shopping. And for foods that do not have a nutrition label, it can be a little bit more challenging to kind of figure this out. This is some of the cases where I think that, you know, even myself as a dietitian, I do a quick Google search on something, you know, how much protein is in X. There are some more, you know, evidence-based options online, so you can look up the Canadian nutrient file online, and that's a kind of Canadian database for all the nutritional info for foods in Canada. So you can kind of learn about the protein amounts on there. So the next few slides, I'll just kind of, you know, mention with a grain of salt. You know, I can't, if I was a bad dietitian, I would be able to tell you your exact protein requirements right now, but I need to know the big picture. So if you're going to make some dietary changes, I think this is a good general guideline. If you've never thought about protein before or how much protein you need, this could be a really good way to kind of get a general sense of what you might need. However, to know the exact amount of protein that you need, I think is very important to kind of sit with a dietitian or someone on your healthcare team to kind of really know how much exactly, because there's so many different factors, other conditions that you might have. So for example, if you have kidney disease, the recommendations that I'm about to go over will not apply to you because there are some different kind of processes that we need to think about in that case. So Canada's food guide has, you know, shifted from this, you know, I think back in the day it was, you know, all these portions of these different groups that we would have, but right now that we have is this plate, right? It's kind of simplify things. We want to have, you know, half your plate, vegetables and fruits, quarter of your plate, protein foods, and a quarter of your plate as whole grain foods. So when you're undergoing cancer treatment, this guide here, unfortunately, is not as applicable. So that's why this can be confusing. So when you are going through treatment for cancer or recovering from a surgery, this plate here may not necessarily apply to you. So when someone's going through, let's say, treatment early on, this is what the protein needs in cancer might kind of shift towards, where, you know, the protein foods start to kind of look at half the plate. So this is kind of to give a representation of how your protein needs might increase when it comes to treatment in cancer. So for calculating protein needs in cancer, so this is a pretty simple calculation that someone could do if you've never had or access to a dietitian in terms of knowing how much protein you might need. So what you would take is this 1.2 and 1.5. So people with cancer will need 1.2 to 1.5 grams of protein per kilogram of body weight per day. So you would take your weight, convert that into kilograms, and then multiply it by this range. So for example, a 75 kilogram person would need about 90 to 113 grams of protein per day if they were going through treatment. If we were to compare that with someone who, let's say, for example, wasn't going through treatment, the general recommendation for protein requirements is 0.8. So that would equal about 60 grams of protein per day. So you can see it's quite significantly higher in compared to the general population. So now going over the importance of protein, though I know that that's a huge number, and it's very challenging when I'm mentioning someone like your protein needs are this now. And then they kind of look at me like, okay, well, how do I do that? So in this slide here, just want to going over some of the quick strategies that you can do to try to increase your protein intake, make sure you're getting enough in it each day. So eating regularly, simplifying it to that point where, making sure that you're eating regularly throughout the day gives you the opportunity to get that protein in. In a lot of cases, appetites are so low that you can't really have those big meals. So sometimes for some people, eating 5 to 6 times a day in small amounts is often a better way to go about things. I, of course, favor, applications, these kinds of things to kind of track your protein intake. So the more you're aware of something, the more likely you're going to hit those goals. So keeping track of how much protein you're having each day can be very helpful in meeting that goal. So you can either do that pen or paper or using some of the apps that are out there. A general kind of rule or guideline that we have is to try to include 20 to 13 grams of protein at each meal. Now, this amount just didn't come out of nowhere. We find that this amount of protein is the best absorbed, the best amount that you would be able to have at a single time. Having more than that, you might not see the benefits quite as much. Number 4 here, focusing on the protein first. So when you're having a meal, focusing on having that protein part of the meal first, because we know that appetite can, suddenly go away as you're eating the meal, and you might not finish the meal. And protein supplements, very, very key in terms of, supplementing the diet. I usually don't recommend these as like a first kind of treatment. I think food first is the best approach. But if you're finding that, just to get to that total goal, when your appetite is low, protein supplements can really come in key. And lastly, talk to your dietitian. If you have access or you're accessing a clinic and you're speaking with your oncologist, see if you can meet with a dietitian. And if it's available, go for it. Take that chance. I think that a lot of the time as dietitians, we're not utilized as much. So ask, is there a dietitian available? I'd like to learn more about nutrition. And in a lot of healthcare plans, you do have that funding, and you can have that spent on dietitian consultations. So even everything that I've mentioned today, I don't want anyone to make any drastic changes today. Hopefully maybe it inspired some potential thinkings about things, but it's always best to consult with your dietitian before you're making any drastic dietary changes. So and this is the perfect kind of bring back from earlier today. So physical activity is also very important for that muscle growth. And as I mentioned, we wanted to stick towards that muscle maintenance and muscle regrowth. So physical activity is also important for that muscle growth. So just a quick breakdown of basically how it would work is that, if you're doing exercise or resistance exercise, it causes small tears in the muscle that you wouldn't be able to see. However, your body would want to repair that. And when you feed the body with protein, the body will digest those protein into amino acids and try to rebuild that muscle. So when you get that enough protein, those amino acids go to work, they build that muscle, and then the muscle grows. And then we also discussed a bit of sleep earlier, right? And this is where that big, importance of getting sleep comes in, where this growing actually happens. So just to wrap things up here, I have some more information that I think would be really valuable in terms of protein. So we have some YouTube videos. If you look up Compassion House, we have that. So there's a YouTube video on there. We have a video on the importance of nutrition to prevent and treat muscle mass. This is also on YouTube. And then part of my lab at the University of Alberta has developed a cookbook. So this is a high protein cookbook for muscle health during cancer treatment. It's available for free online, but as well you can get a printed version on Amazon for about $12-ish, I think. And I have a few to give away today, and I know there's a lot more than 3 people here. But if someone, let's say for example, I'll reserve these for someone who's maybe has someone that has recently got diagnosed and looking for some recipe ideas, then feel free to grab it from my table. Okay. I don't want any fighting over these books, I know. Yeah. Yeah. And thank you so much for listening. I know it's been a long day, but I just want to acknowledge my great supervisors, Dr. Carla Prado. She does some amazing research in the cancer literature, and Dr. Panita Tandon on the right there for helping me study these kinds of really important things. So thank you all for listening for my presentation. And yeah, that's my email there if you have any questions. But happy to take any questions now.
Thank you. Where you said you can find the PDF version of that online? Where's that?
I think if I will. Can I provide it somewhere? And then, yeah.
It's at the University of Alberta website.
Yeah, University of Alberta. If you Google the title, it'll pop up at University of Alberta.
Does anybody need that title again?
Okay. Yeah, the High Protein Cookbook for Muscle Health During Cancer Treatment. Yeah, I'll next presentation. I'll put that on the slide.
Okay, great.
Yeah.
Does
It's online at
it's
University
right here. There's
of
the name of
Alberta.
the cookbook is right there. Does anybody have any questions? We always get lots of questions
Yeah,
from nutrition.
Nutrition gets the most questions, so.
Thanks very much for the presentation. I'm almost 9 years a myeloma patient. I've suffered from gastroparesis since my first treatment. I'm also almost lactose-free and gluten-free. So I have a real time trying to get enough protein in my diet. Any suggestions?
Yeah, that's a tough one, and I can admit I'm not a gastro-specialized dietitian, and when we have those dietary barriers, can be very challenging, because if you're not able to have milk, dairy products, because we're trying to avoid lactose, then I usually shift to the plant proteins, but a lot of the plant proteins are high in fiber, which can cause stomach.
They're too dense. Yeah, I can't have anything dense. No meat, no dense meat, no dense breads, nothing dense. I just can't digest it.
So unfortunately, I can't give you the tailored care that I wish I could provide you right now, but yeah, it is very challenging, and I understand.
So
that.
I need to
Yeah.
book an appointment? Is that what you're saying?
There you go.
Thank you. I'm wondering if pressure cooking will enhance or destroy the protein?
Yeah, that's a really good question. So in terms of using pressure cooking to cook the protein, I don't think that will change the nutrient profile versus other methods of cooking. So it should still retain its nutritional quality.
Okay, this all depends on whether you get your PhD or not.
Okay.
How well do you have to cook your meat? Can you eat it blue rare, or must it be shoe leather?
Well, as my parents grew up, they love their meat well done, and I think in the in the grand scheme of things, when we compare all of the different things in the diet, if we're going to fixate on that specific thing, I'd want to tell you to enjoy it the way that you want to enjoy it. I would say maybe in terms of cancer prevention, let's try to limit the amount that we burn it and have those burnt sections. So, yeah.
Doctor!
Anybody else? Yep. Oh, sorry. You can tell we're in Alberta, Brian.
Okay, thank you so much. I want to ask you, do we have bad protein?
Bad protein?
Yeah.
Yeah. I don't think any protein is bad. There is differences in terms of animal versus plant proteins. So in general, someone who follows a more plant-based diet, let's say vegetarian or vegan, I would highly recommend those types of people to work with a dietitian, because the amino acid profile of a plant protein isn't as good as a animal protein. So it's more challenging to get a complete protein profile when you follow a vegetarian or vegan diet. Yeah, so there's no bad protein. There are, let's say, sources that are maybe not as nutrient dense, like let's say processed meats, right? They do provide protein, which is great, but there's also some other factors such as high fat, high salt that we would want to limit, right?
Okay, so this question has to do with myeloma itself. Some of us in here will remember the diagnosis, when we were told that we had cancer, usually it's going to be a kind of elevation in the protein level in your body. How is the protein that we are eating related to the protein that we measure when we do our blood work?
That's a really good question. Because of the complexity of cancer itself, so there's a lot of different things that can change the level of your protein in your blood. Let's say your physician's looking at that. There are some measures that we use in clinical nutrition where we can say, okay, your protein level's low or your protein level's high, and we can kind of correlate that to how much protein you're eating. But a lot of medications will cause your protein to jump in your blood, so it's not a perfect system. But yeah, in general, protein will affect it, but it's not like that's the only factor that's going to have your protein levels change in the blood.
So we may not be able to have too much protein by eating protein, can we?
When it comes to protein, the one that comes to mind where protein might need to be limited is like someone who has, let's say, kidney disease, because the kidney has a big role in terms of filtering out the extra protein from the body. So if you have kidney issues or have reduced kidney function, that's when protein intake might need to be kind of capped at a certain amount.
All right. We don't have questions online so far, but I would just, yes, before we go in the room again, you went very fast on a slide where you mentioned that the importance of sleep for the absorption of protein. So if ever some patients, like they have trouble sleeping, what's the impact?
Yeah, so, well, it is very important, and I guess maybe, I did kind of rush over that, but basically, that slide I was referring to is that overnight, that's when the muscle growth will occur. I'm not a sleep specialist either, so I can't answer that question in depth, but I know there's, definitely different types of aids when it comes to helping sleep, but I would refer to the physician for that kind of question, yeah.
Okay, a number of times in your presentation, when you're talking about animal-based protein, you were referring to red meat. What's your opinion on other types of animal-based protein, like chicken, for example? How would you compare them to each other in terms of what is better for you?
Right. Yeah. No, that's a good question. So all animal-based proteins will provide that complete nutritional profile. So in terms of a protein quality level, they're basically on par. A lot of people will have preferences for specific types of protein. And I mean, if you like chicken over red meat, then I would take that route. But in general, like, they're going to provide the same amount and quality.
We got time. We got the luxury of time today.
Can you tell me how long it takes to rebuild muscle if you've lost it through cancer treatment?
Very dependent on what else is going on in the whole big picture. If there's like ongoing medications, some medications kind of reduce the ability to kind of gain muscle, that kind of thing. It depends on the amount of exercise that you're doing as well. So if you're doing strength training, the more you can add to that during that time can kind of synergize the nutrition and the exercise, so they go together. So I can't really say there's a specific timeline, but we know that being able to preserve it is going to be a whole lot quicker than trying to rebuild it.
Yeah, but if you're past that stage,
Yeah.
you're like, just because I think I lost a lot during the treatment, even trying to preserve.
Mm-hmm. I think everybody's like potential to build muscle is different, so I can't give a specific timeline, but I think that if you follow those principles of getting enough protein, adding in some good exercise with some resistance training, it slowly will start to pack on. Yeah.
Making me exercise over here. Get my steps in.
Thank you. At the beginning of your presentation, you mentioned that protein does affect nails. So what can be done when cancer patients that their nails are always just breaking? What can be done? That's one question. Maybe you want to answer that.
Yeah, I mean, from the topic that I'm discussing is trying to get that protein in. I don't know any specific nail tips in terms of preventing them from being brittle, but likely if they are brittle, then that kind of informs us that there's probably some malnutrition going on. So that nutrition should be a little bit more of an importance. Yeah.
Okay, thank you. Then the second question is, when my husband was diagnosed, because in our community people don't talk about it, but we were told that you should stop eating meats, anything that has to do with animal something, no dairies, and we should just be juicing like carrot juice, eat raw food and all those things. So I asked the oncologist that, okay, if you stop eating all these, then it's not going to have any energy or anything. Then he said, oh, you know what? He's already sick. Give him whatever he likes. But up till today, I know some people in the community that says that they changed their diet. So they are now on maybe no meat. They are now on organic food or something. So what do you think? Should we continue with dairies? I know you said it, because I don't know the difference between having all the dairies, all the plants, and also having the meats food.
Yeah. So like when we're thinking about after the diagnosis of cancer and that immediate treatment period, things are rough already. So when you remove someone's main source of like food that they enjoy, at that point we want you to eat anything, right? Because if you don't eat anything, it's just going to come off, right? So I think that when someone gets a diagnosis, we immediately go like, we need to remove food from the diet when we should be adding food to the diet. So you're getting enough nutrition. And so when we're in hospital, so I didn't work in hospital too much, but basically, you know, if someone's super sick, eat the ice cream, eat this, eat that, to try to get as much as you can in so that you're not losing muscle as quick. So we kind of prevent that wildfire from getting too out of control. Down the road, when the treatment can kind of slow down and things are looking better, then maybe we can look at diet quality a little bit more, making better choices in terms of those things. So it's really hard, right, when it's just after treatment. So we, in a lot of cases, it's quality of life that we're looking for. I hope that answers your question.
Hi, I'm a nurse. I'm the nurse, okay? I just want everyone to know that when we're looking at your protein, we're looking at your monoclonal protein, which is not the same as the food protein. So I don't want you to confuse that. So yes, and we do limit the protein, especially if you're your heavy chains are going up. That means your kidneys are not functioning as well, and this is why we limit the number of protein in your diet. I just wanted to make that clear, because you had an excellent presentation. Love the meat, but yeah.
Okay. There's a number of different protein things that we measure, right? So yeah, thanks for clarifying that.
Anybody else? Online questions, Karen? Yep, we got one more.
Is there, like, she told me there's a test that you can always test for fat levels in people, but is there a test that tests the amount of muscle mass versus your bones and fat in an individual?
Yeah, so there's a lot of new methodologies of testing like body composition. At the University of Alberta, we have lots of big machines that kind of do the full kind of workover and kind of see the amount of bone, muscle. So one is called DEXA. There are some commercially available like products where it can kind of check the currents through your body, called BIA, to kind of see how much muscle that you have. It's not necessarily going to be as accurate as those big machines that we do have, but there's also other ways to test your muscle amounts, like calf circumferences, those kinds of things. Ultrasounds can test your muscle. So there's a number of different ways. Now, I don't know how accessible those are to the average person.
Do you need do you need like some pigeons to test, and I could come up there and you could test me to see how much muscle mass I have?
There are always studies in the Human Nutrition Research Unit where there are tests for those kinds of things. So I would keep an eye out on online if there's any studies that are happening from like the Prado Lab or the Human Nutrition Research Unit in University of Alberta.
What was your first one?
Prado Lab. So Dr. Prado is my supervisor, so that's kind of our lab group. A lot of her studies look at nutrition and cancer, those kinds of things. So you might be eligible for some of the studies that are going on there.
Okay. Thank you.
Anybody else? Good discussion. Great.
Yeah, when you present nutrition, you keep the presentation short and then the question period long, because that's
Yeah.
usually what happens.
Well, thank you very much. That was very, very well done. Very much appreciated.